Ouch! Well, the days of old-fashioned hair removal are gone for good. Now that hair will go away with Smooth Away, the fastest-selling, most popular women's product in Europe. You'll smooth away unwanted hair in moments and exfoliate at the same time.
I don't have to shave. I don't have to shave ever.
It's gone. That's pretty cool. So smooth, and it works so easy.
Each Smooth Away pad is covered with super fine crystals that buff away unwanted hair, leaving your skin so soft and incredibly smooth. Use the full-size Smooth Away pad for your legs, arms, underarms, and the small one for smaller areas like the upper lip and chin. Smooth Away works wonders on sensitive areas like the bikini line and will never leave those unsightly razor bumps. To use Smooth Away, just buff lightly and the hair is gone. It's amazing! Best of all, Smooth Away works instantly and is 100% pain-free. And because Smooth Away exfoliates as you use it, your skin will feel incredibly smooth and soft, just begging to be touched. Oh, and Smooth Away works great for guys, too. Finally, there's a real answer to easy, safe, painless, and oh so inexpensive hair removal, because now anyone can enjoy perfectly smooth skin with Smooth Away. To order, call our toll-free number and we'll rush you the complete Smooth Away system. The large Smooth Away for legs and arms, the mini Smooth Away for lips, chin, and sensitive areas, plus 4 large and 4 small replacement pads so you always look smooth. This package sells in Europe for $40 or more, but buying direct, it's yours for $19.95. But wait, call right now and we'll double the entire offer and give you a second complete Smooth Away set absolutely free. Just pay shipping and handling. That's right, 2 complete Smooth Away sets, an $80 value for only $19.95. So call now.
A lot has changed in 90 years, colors, fashions, trends. But for the last 90 years, Murray Johnston Menswear has delivered the latest styles and trends, assuring high-quality, personalized service and competitive pricing. Murray Johnston's personal service includes a home visit for wardrobe consultation and extra service for no charge. For your complete wardrobe needs, Murray Johnston Menswear. Good service never goes out of style. 8 Simcoe Street North, Oshawa.
Ontario Power Generation is proud to be a leader in Durham's vibrant energy sector. About 30% of Ontario's electricity is produced safely right here in Durham Region.
As a nuclear operator, my job is to ensure safe, reliable performance to meet Ontario's electricity needs every day of the year. Nuclear operators are lifelong learners who undergo years of stringent training.
Ontario Power Generation in Durham Region. It's where we work. It's where we live.
Welcome back to First Take Live. You know, this time of year, it's always a thing that we think about is our good health. And of course, if you're in pain tonight, you're welcome to call in and talk to Dr. Dave Harper. He's my guest tonight. And we're happy to tell you about some new technology that, you know, I love technology because I think that it can really help move things along quicker. And why would we not expect it when it comes to spinal care? All right, now, but for those of you that are, you know, really interested in health and doing something with it, there is an expo that's coming up. It's coming up on March 1st. It's the Health Matters Expo. It's at the Ajax Convention Center. This is year number 2 for it. Last year was famously attended, and a lot of the people that we'll be featuring over the next 5 weeks are going to be people that will be a part of that Health Expo, including some of the key speakers. So, you know, it's right in our neck of the woods. And by the way, the admission is $2 at the door. It's $2 going to go towards a charity foundation, so they're not even grabbing you at the door. Congratulations to them. So Health Matters Expo coming up March 1st. Make sure you plan for it Sunday afternoon or Sunday morning right through the afternoon. And it was a great event last year, and we hope that you take it in this year. Dave Harper joining me here. Dr. Dave Harper, doctor of chiropractic, wellness expert, I would say, and open-minded professional. One of the things, Dave, that I've noticed over the years is that you've come across different technologies, and but you're not married to them.
No, I'm not.
Which is kind of unique because a lot of this technology isn't expensive.
Yes, it is.
It is an expensive item. And you know, a lot of people say, "Okay, I bought it. Now I got to keep it so long until I pay for itself." But the speed of technology, you made a couple years ago, you had a very different machine that we're talking about that was working with people with back issue, but now seems to be solving that problem.
Yeah, if you're talking about the spinal decompression system that I have, I actually use them together.
Oh, do you?
Because when somebody comes in, if they've had a disc herniation in the lower back, and we put them on the table for the decompression, we really want to make sure that we would be gentle in our manipulation. and in our adjustments. And so this technology, this Pro Adjuster technology, allows me the opportunity to be very specific and to be very gentle, and then to be very focused in the area that I'm looking at. So because there is a rescan, so the visit that a person has is that there's an assessment, there's a scan component, there's a reassessment, and then, treatment, and then a reassessment. I brought an example of a good one. I don't know if it would show up on the screen or not. Is that something that we could hold up?
I don't know if we can get it. We'll see. If we can't get it, then they'll tell me. All right, there we are.
So what we're seeing, this is of the neck, this is the pre-scan, this is the post-scan. What you're seeing here in the waves that are all over the map compared to this particular scan is that each of the vertebrae that have been tested show different mobilities. Some of them are more fixed or more stuck, more rusty than other ones. And after the treatment, you'll notice that they're nice and low, nice and curved, all together in one small, tight band of curves. Each one of these little colors, each one of these boxes represents an assessment of a different vertebra. So
the ones that are all wonky there and little,
the one here?
Yeah.
Yes.
That's something that needed fixing.
That's correct.
And then after you use this wand, which we'll hold up in a second, then you end up with the one on the right where they're put together.
The higher the curve, the greater the fixation. What that means basically, Garth, it has a greater difficulty getting moving. So the heavier an object, the more effort is required to get it into motion.
Okay.
The lighter the object, the less effort is required.
Okay.
So it's the same thing with the vertebra. The tighter the fixation, the greater the restriction, the more difficult it is to get going. That's what we would palpate by hand. The system now puts that on the screen for myself and the patient to see where the problems are.
So I guess the part I'm still having trouble wrapping my head around, hold that thing up.
Okay.
This is it.
This is it. This is the actual instrument that we use, and it comes to, I didn't bring the whole system with me, Garth, because we couldn't do that, right? But it hooks up to the computer through this end.
Yeah.
And so the computer program that's inside the hard drive is the part that's assessing it.
But how does it cause the adjustment?
Oh, very simple. Once it assesses, if I was able to have this hooked up, you'd hear it click as it reaches a certain point. There's a 6-pound preload, which means that once it reaches 6 pounds, it fires. That's the nature of this piezoelectric sensor.
So that guy goes like a jackhammer?
Right. So if I did it on this surface, it would be very, very
boom.
It'd be a very hard, rigid, because there's a lot of reaction to this instrument. So the more rigid it is, the more rebound there is against the instrument, the higher the curve, the more the fixation.
Okay.
Then when we adjust, I set a certain impulse rate and a certain amount of strength for the adjustment depending upon the area of the spine.
So you set that on the computer?
I set that on the computer.
Because you're trained to do that.
Exactly.
Okay.
And then what I do is I achieve, or I look at the scan and I pick the area that has the greatest fixation or immobility or lack of movement. And then it taps on that.
Okay.
And it taps on that until it registers that there's been enough, and then the system shuts off by itself.
So you can't over-adjust?
Can't over-adjust. It's impossible to over-adjust because the system is monitoring as it is applying the technology of the adjustment.
One of the concerns I've often heard from lay people, not from the chiropractic profession, that people would say that there would become a hypermobility with over-adjustment when it comes to manual. And one of the questions I always had was the chiropractor that starts their practice at 10 o'clock in the morning, and the adjustment they do at 10 is as good as the one they do at 6 o'clock at night. I mean, nobody could, and I'm not saying that's not their intention. We're human beings.
We're human beings. I started work, I work 3 days a week, 12 hours a day, from 7 till 7, Monday, Tuesdays, and Thursdays. I have another associate in the practice that's just starting now, working Wednesdays, Fridays, and Saturdays. So the office is open 6 days a week in Mississauga. I don't have to worry about that anymore. The system does not get fatigued by the end of the day. So the quality adjustment at 7 a.m. is going to be the same quality at 7 p.m. in terms of the applied force to that area.
Let's talk a little bit about the people that have been presenting to you. There's new people that are coming to you because they're hearing about this, and through shows like this, which is good. People that are coming to you, they're presenting with long-standing issues and have avoided chiropractic. Give me some stories.
Well, I have one of the most interesting examples is Anita. I brought her testimonial with me. This particular female patient, just a wonderful lady, was looking at, in her words, committing hara-kiri because of her pain. She had positive MRIs, but she was not a candidate for the decompression because of her bone structure was too fragile. We use the laser that I use.
How old of a lady would she be?
Mid to late 70s.
Okay, all right.
You know, so it's not someone that you would want to apply a lot of force to. And we've been able to use the laser and some soft tissue work that we've talked about before when I've been on the show, active release technique, and this Pro adjuster. And she's looking at playing golf this summer. We're now putting her through a strength rehab component of her program where we're keying her up because she wants to get back to playing golf. And she was referred by another colleague because I have this technology, and it's just been a wonderful, wonderful observation to see her change in demeanor. Her life is back. She's hopeful again. And again, this is someone that in the past, it might not have been the appropriate thing to apply force. There may have been some contraindications to applying a certain level of force, but we can do that because I can tone down the system to a 10-pound force for an adjustment throughout her spine, which is, you know, about the same as what you might have if you bumped into a wall.
I guess that's always the question. I mean, I've seen different, you know, with my spinal cord injury that I had and the surgery I had in 1992, I had to then go back to chiropractic because I had to, which, you know, I'll have to say that the chiropractor missed, the doctors missed it, and even the chiropractor I was seeing at the time missed the fact that there was some problems going on, the lady I was seeing. And then I, you know, I ended up having this disc back injury and paralyzed from the waist down, had to learn to walk again. And then what happened was, you know, all of a sudden the facet joints started to lock because of the imbalance in the muscle structure in my body. And there wasn't anything that the medical society could do for me. They tried to give me anti-inflammatories, didn't work, and of course those are just drive your system up the wall. Yeah. So I crossed my fingers and I went back to a chiropractor, and you know, and I just said, you cannot manipulate, but she at that time used the activator.
Sure.
And you know what, and that sort of freed up those facet joints.
And it's a very similar tool, except that one's a manual
push
application, okay, which is a one-time load. It's a great tool. This just happens to assess and scan, and then it uses the computer to be able to pick the right load levels to apply to the spine.
Right. I mean, and I went to another chiropractor who had me sort of have these sort of boxes that you kneeled on and whatnot, and you know, after he did one of those major pushes, it was a deep concern. I watched and he was a pretty strong guy, and I obviously I would need that, but then I felt I was over-adjusted because I was even worse than I walked away. So, I mean, I've been through a lot of chiropractic care, I mean, a ton of it. And I guess the question is that, you know, if anybody had a reason to be skeptical, it would have been me. But I am a fan of chiropractic. I'm kind of a fan of what we're talking about here. Now, when we come back from break, we'll talk a little bit more about this, but then you brought the laser.
I brought the laser.
And you brought the laser you had on a couple years ago, and you said to me, Garth, I think we can fix what's going on with you, because you pushed my arm down. You said, oh yeah, I can fix that. So we're going to find out how it can be fixed. Dr. Dave Harper's here. He's going to fix me. See, he'll be helping me talk. Right back with First Take Live right after this.
Men's clothing is provided by Murray Johnston Menswear.
The Cash for Cancer Lottery is back, celebrating 10 great years with incredible odds to win. New bonus draw, $100,000 cash tax-free. Win one of 10 super early bird prizes, $10,000 Costco shopping sprees, over 11,400 prizes, cars with free gas for a year, a kitchen renovation, dream vacation to Italy, and $1 million tax-free. Call 1-877-460-3800 and help the Oshawa Hospital Foundation fund and equip the new Durham Regional Cancer Center.
Keeping it green, we all have our role. And sometimes just the smallest little action can make a huge difference, like turning off lights and computers when they're not in use, conserving water, taking public transit or carpooling, and of course, recycling. Just a few little things we can do today that will make a big difference for tomorrow. The Municipality of Clarington, greening our environment, and a proud partner in the Clarington Green Challenge.
There's nothing that we can't do to get you a car loan. As long as you're ready to or willing to work with us, we'll find you a vehicle. We'll get it done. If we don't have the car for you, we'll go out and find the car, bring the car in, bring it to you, and we save you thousands of dollars from what the other guy's selling it down the road for, because it's not in our inventory for a long time. It's in there specifically for you.
It's time for the Great Refrigerator Roundup, your hassle-free way to get rid of your old fridges and freezers. These electricity guzzlers can waste up to $150 a year. Book your appointment for pickup today.